and welcome to Newsmax Health. I'm John Bachman. Today we're talking about beyond Viagra, choosing the right ED drug. Since Viagra was approved by the FDA in 1988, the little blue pill has become a household name and part of our culture. But these days, there are a host of lesser-known erectile dysfunction drugs on the market, including Cialis, Levitra, Staxyn, and Stendra. Here with Newsmax Health now to sort out the choices is one of the nation's top health authorities, Dr. David Samadi, Vice Chairman of the Department of Urology and the Chief of Robotics and Minimally Invasive Surgery at the Mount Sinai School of Medicine in New York City. Dr. Samadi, thanks for being with us.
Thank you, John.
And it's good to see you again. First of all, when should a man consider to start taking these, when should he start considering, rather, to start taking these ED drugs?
You know, part of the natural aging is that as time goes on, there's going to be some wear and tear. So as we get to their mid-40s, early 50s, there's going to be some blockage in the arteries, in the penile tissue, and therefore the erectile dysfunction can kick in. When we see this in early age, if you see ED, erectile dysfunction in younger guys, that would be a sign of cardiac issues, and that's how we know that major vessels in the heart is blocked, and the same thing can happen as a result of erectile dysfunction. But certainly in early 50s and mid 50s, you know, the libido goes down, which is as a result of testosterone, and also the sexual dysfunction kicks in, and that's when more and more patients will come to us and ask for these kind of medications. That's around the era where we see some of these patients complain about sexual function.
Yeah, you mentioned those cardiac issues. Another reason why younger men should stop smoking and start eating better as well. Now, do men need to wait until they start having problems consistently to start taking these medications? Or, you know, if it's just every once in a while type thing where he's not functioning as well as he wants, should he start considering these drugs then?
Well, you know, the best thing is always not to take the medications if you can avoid it. But sometimes, you know, it can affect the marriages and the wives and the relationship. So that's why these medications are important. They're fairly safe. We have a lot of them, as you mentioned. You have Viagra, you have Levitra and Cialis. They work similar, but there are also some differences. Viagra and Levitra usually last about 4 hours. They're short-term kind of medications. Cialis stays in the system 24 hours. So depending on what the patient's needs are, then we individualize the care. And I may start with Viagra or Levitra and see how they do, what kind of side effects they have, etc. And sometimes if they don't work, I may move on to Cialis. And just because one medication doesn't work, it doesn't mean that the other one may or may not work. So it's good to do 3 different times and see which one would really work for you.
And that leads me to my next question. What are the differences between these drugs, and is there one that should specifically be the first choice a patient should consider?
Like I said, I usually start with Viagra and Levitra. It's important for people to know that you should take it an hour before having sexual activities, and also you have to take it with empty stomach. And this is one of the big issues that a lot of people may or may not know. Typically, they have a big dinner, they have steak, they have a lot of fatty food, wine, and then they start taking the Viagra or Levitra, and that won't work. You have to make sure that it's empty stomach. An hour before, there has to be foreplay. It's not just automatic that you take the medication and there you have the sexual function going. So that's when I would start. Then, if I want more prolonged activity, 24 hours, etc., medications such as Cialis, which we have now 5 milligrams, it's a daily Cialis, or the higher dose, which is good for the whole weekend. It's a weekend pill that they take. Sometimes you don't want to give the Cialis at the beginning because if they have the side effect, it may stick around for the whole entire weekend. They're not going to be happy. Also, for whatever reason, sometimes you may give Viagra to somebody and the patient, and it may not work, but Levitra may work, or vice versa. So it's a matter of adjusting it and see which formula works better for the patient.
Now, we hear a lot also about the mental aspect of erectile dysfunction. When you're considering, drug therapy to treat ED, how much do you talk to your patients about their mental state and their confidence?
Well, I think that's a huge part of this because, if you have to be mentally confident, and a lot of this performance anxiety plays a huge role. Sometimes they may be absolutely perfect, but they need a little boost with these medications. There may not be any mechanical problems with them, but just that boosting the confidence helps a lot. And a lot of these oral medications quite work. If they don't work, then there are many other options, John. We can go on to, for example, there are suppositories available, something called Muse, and then they place that in the urethra, and Muse certainly works if the oral medications don't work. Sometimes a combination of the two would be the way to go. I may give a Viagra alongside with Muse, and that would work. There's also vacuum pump for some of the patients that have had surgeries. We may start them on these vacuum pumps. And what it does, as a result of vacuum, it brings the blood flow to the penile tissue and causes erection. Certainly, penile injection is quite popular, meaning that if all of this will fail, there are certain injections that we can give, and they get full erection and sexual function immediately. And finally, if all fails, there will be penile prosthesis. That's a surgery. It's almost like getting a pump, and that is a little more extensive, but there's always help. So that's the way to go.
Yeah, and you can't put a price on saving a marriage if that's what it comes down to, and all that gives hope to people that if something doesn't work, there's also other options out there. Let's talk about the risks a little bit that are associated with these ED drugs. We all hear about the warnings on the commercial, these 4-hour erections. But what are some of the other risks associated with ED drugs?
Well, you have to make sure that you absolutely are not taking any nitrates. That's one of the contraindications of taking these medications. If you are taking nitrates, you're absolutely not to touch these medications. Most of the side effects that we see is basically very mild. So they may have nasal congestions, they may have headaches. The ads basically talk about the fact that if you have an erection for longer than 4 hours, come to the emergency room. That's extremely rare, and I haven't really seen one that happen. So that's just for safety that the drug companies put it in there. But for the most part, some of the side effects are mild. Low blood pressure, headache, dizziness. There were some cases of blindness years ago, but we don't see that as often. And certainly if you have any kind of retinal detachment or eye issues, you should talk to your doctor before you take these medications.
Yeah, we know sometimes these drug companies have to report these side effects no matter how rare they are.
That's right.
And even though we see these commercials, especially for us guys that watch sports a lot or, male-oriented program, these commercials are in almost every single commercial break, but still there's studies out there that show that ED is still vastly undertreated, perhaps reported by patients, with only about 25% of men with erectile dysfunction getting treatment. Is this just because men are just too embarrassed to talk about it?
Absolutely.
We know men don't like to go to the doctor a lot of times. This just plays into that?
It's true. That's absolutely right. And I think it's a very sensitive topic. It's quite embarrassing. That's why a lot of times when you do the interview in front of the wives, they kind of don't know how to answer it. So the best is, as a physician, to bring them to the exam room, and that's when they will open up and really admit to some of the issues. Now, there's a whole spectrum of erectile dysfunction. There are some that absolutely can't get any erection whatsoever, and some they can get the erection, but they may lose that sexual function during performance. So there's a whole spectrum, and a lot of times, look, this is embarrassing to them. It's a performance issues, and it's good to do a private interview, get all the facts. And what I want people to know is that there are a lot of good treatments out there. Talk to your urologist and individualize the care, and we'll see what's the best for you. But you should enjoy great quality of life, and sex is a huge part of this.
It absolutely is, and hopefully guys can find a doctor like you who makes this information accessible as well. Dr. David Samadi, thanks for this interview, and thanks for talking to us.
Thank you very much.